I needed a knee replacement. I went to my family doctor and he sent me to an orthopedic surgeon, for which I waited a year and a half. He put me on the waiting list for a knee replacement a year and a half hence. I couldn't do very much at all, and it was getting steadily worse and more painful all the time. I was sick of being on strong painkillers, being knocked out by them half the time. Enough is enough. It is an oxymoron, of course. You don't go for vacation on this medical tourism. You go for medical intervention. With the orthopedic specialist, I saw him within a month, and I had my surgery 6 weeks later. So it was very convenient time-wise. Very convenient time-wise. The only obstacle being, of course, that it costs money.
When I was 27, I started experiencing severe back pain. I was referred to an orthopedic surgeon, and the appointment was for a year after that. I experienced a lot of pain. I started needing a cane to walk, then 2 canes, then I started using a walker. I lost control of my bladder and bowel functions, so I wore diapers. Finally, I met a surgeon, the 4th surgeon that I ended up seeing. He said to me, "You are too young to be living like this. You've got kids to raise and a life to live." He agreed to do the surgery, and that took place 6 months afterwards. So in total, from first bouts of pain to surgery was 3 years.
I waited 7 months. I saw the hip surgeon, and he told me, "It's not your hips, it's your spine. You'll have to find a spinal surgeon." It would be another year and a half to 2 years before I would get that surgery. What's your life worth if you can't do anything?
Well, right behind me is the Ambassador Bridge, and that connects Windsor, Ontario, Canada, where we stand right now, to Detroit, Michigan. Well, you know, the Michael Moore movie, I was a little bit flabbergasted by it. When you walk into a waiting room and you talk to someone and they've been interviewed or they've been sitting there for 5 minutes, you need to come back 5 hours later and see if they're still sitting there. More Canadians are going over to the United States for care, certainly, than any Americans are coming into Canada for care.
I had some neck injuries, and for the first 3 years they were telling me everything was fine, and I was in extreme pain, and the wait list to see a specialist here was 18 months. By the time I made 16 months, I was pretty much bedridden with pain. I couldn't work, I couldn't do anything. Every minute was a day. It was horrible. There was a place in Florida that I went to, and I will say they definitely saved my life. There's no two ways about it. I had to pay for it, but you know, when you can't put a price on your life.
I had my first hip replacement in 2006. I waited 3 years for that one, a little over 3 years, and then I went back to work, and I was there for about a year, and my left hip started going. And my left one went faster than my right one, where it was just bone on bone. And all I could do was take more drugs. They just fed you more, higher dosage of morphine. The medical clinic in the States has given me my life back.
The wait lists vary from province to province, but in general, there are about 800,000 people in Canada that are on wait lists. We send them to the US, and our other countries are Mexico, Germany, and India. As far as the patient is concerned, they get the surgery, and their vacation is basically their rehab in a 5-star beach resort where they're just resting up on the beach, and particularly in the case of orthopedics, the main thing that they need to do after surgery is walk. And what better place to walk than on a beach?
Pretty sure that I contracted Lyme disease in 2000, and trying to get a doctor to treat me for it, it's impossible. I've got an appointment in October to go to New York.
If the US changes their medical system, where are Canadians like us going to go?